Bob, Jensen, anything on concessions?
No, we're ready to go for next Friday at Safeway. So
Okay.
Lloyd is charge of sign up, so get a hold of him if you're interested. Hopefully the weather will be a little bit warmer than it's supposed to be this weekend. And
I hear it's supposed to get colder next week.
we'll find out. Gotta start sometime.
Yeah. And it's 2-hour shifts, right?
Yes.
Okay.
Yeah.
Okay. So I think it starts at 10 and goes till 6.
Yep.
Okay.
Dwayne.
Okay. So if you want to work a 2-hour shift, just let Lloyd know.
Leroy,
Yeah.
what are we charging when we do a courtesy?
Greg Firth, anything on membership?
Not at this time.
Okay. Ken Patero, anything on Zoom?
We have a Zoom workshop tonight at 7 o'clock on Zoom. We're going to discuss the senior graduation program along with the Knights of the Blind.
Okay. Any sunshine report? Anybody? Okay, guess not. So, any happy or sad bucks? Lloyd?
I got a sad good buck. Spent 5 hours at ER last night, but they took care of me.
Oh,
Oh,
that didn't sound fun.
It wasn't.
How
Dwayne?
did you get away with only 5 hours? Mine were always 6 hours.
Yeah, but your lobotomy took longer.
Yeah, that's right.
I don't know what happened. Did you get all that?
Okay. Dwayne?
Sad buck
Okay.
for passing of Bob Heidemann, our
Yeah.
past president from 1990.
All right. Yeah. Sad. Leroy?
I have a happy dollar, and I don't want any singing, so I'll get that out of the way first. I finally have turned an age where I'm catching up to where most of you are. I turned 60 on Sunday.
Yeah, ways to go. Sorry.
I'm chasing you.
Happy birthday.
No.
To you.
Okay.
Happy birthday to you.
I'm not singing.
Thank you. Marilyn, you have a beautiful voice, though, so.
Wait,
Heart stirring, so beautiful.
was that the program?
Marilyn?
I have a happy butt because I wanted to share with Leroy. You know our grandson Sison, and he told me I could be 57 forever. So that means you're older than me today.
That's right.
Right.
There you go. I have a happy back. I just got back from a doctor's appointment, and I'm doing a hip replacement in June. So I can get rid of some pain. So it's kind of nice that no questions this time. He says, "Okay, when do you want it?" So.
Hey, you have to wait one more month. You're president during June.
You can't do it during June.
But it's just kind of an in and out thing.
Oh, really?
Yeah, if it wasn't for me having a blood clot, it would be an in and out on the same day.
Wow.
Now I just have to stay one night over in the hospital because of the Eliquis I'm on. So, but otherwise, yeah, nowadays it's just an in and out, like hip and
Yeah,
knee.
but how long is recovery?
In 2 weeks I can go back swimming. There's a deal hills. I'm good to go. So
Good job.
before I had to wait 30 days before they'd even let me in a car. Now it's like no problem at all. I already asked them about if we're in meeting. I could meet with you guys, so there's not going to be a problem. So
Oh, good job.
yeah. So
Who's your doctor?
Dr.
Who?
Turner.
Oh,
Yeah.
good luck. He's a good guy.
Yeah.
Good guy.
Yeah. He's done 4 other surgeries on me, so He knows.
He knows me.
Yeah.
He must have reinstated his license, huh?
Yeah.
Good.
We just have to remember she'll be on happy pills during the time.
Probably not. 'Cause I went
No, Dolly.
She'll be wandering around saying, hip, hip, hooray.
Oh, cute. That was cute.
Last time I didn't do any all, just the Tylenol. So, Marilyn?
Oh, I just saw a couple of lions that I love to see, and it's Nick Lemire and Ryan Littlefield. I just wanted to know, I love that you like to join us old people and laugh at our jokes. It's great. So there's a happy buck.
Yeah.
You too will catch up to my age.
I saw Gary Hill the other day too. He's doing okay. So, saw him at the Y. So.
What's the update on Pat, Hal?
He hasn't got the results back from last week, but on March 11th, he sees his doctor.
Any other, Steve?
Yes.
Thank you, Darlene. I have an announcement now. Next week we'll be doing orientation, and for those of you who have sponsored new members,
Okay.
be a good time to remind them, and they'll get their orientation in next Tuesday the 9th. So Doug and Dolly, you're a sponsor, and Barry, I can tell Rosemary, I think.
Yeah, it was today. I got some people who want to go out sailing tomorrow, and so I'm cleaning up my boat and going, it smells in here.
What's that?
So,
Al needs to mute.
oh, well, I'll see if I can put.
Yeah.
Eileen,
Yeah.
I got the new packet, so I need to set up a time with you to have you sign the certificates, 5 of them.
Okay. Just
I
let me
got
know.
them though.
Yeah. Just let me know.
Yeah.
Okay.
Not a problem.
Yeah. So we have 5 new members. Doug and Dolly have 2. There's one from
Tom has, did Tom
and then
have
Tom Fulton's sisters. So
Right.
Yeah. 2 for Tom,
that's
for
that's
Doug,
it.
And then we have Terry too. So.
and then Terry.
Yeah.
So there's 5 of them.
Rosemary,
Yeah.
Rosemary would like to attend next week again. So
Okay.
I'll
Okay.
forward that.
It's on my calendar.
Okay.
Oh, cool.
All right.
Okay, that's it.
Right. Any other happy or sad bucks? Anybody? Doug?
I have a happy buck. I'm sitting here looking at Cheryl Coates, and I want to thank her for doing a great job of my newsletter this year. She just got another one out yesterday. What a great job. So absolutely happy buck on my part. Thank you.
Thanks for the opportunity. I enjoy it.
All right. Anybody else? Okay, I'm going to turn this over to Gina.
Yep, I'm here.
Okay.
All right. Well, I am pleased to be program chair for the month of March, and I am aware that we have orientation next week, but this week we have our very own Larry Hembree with us. Most of you know Larry as someone in the community who is very active, and he's very passionate about our community. He actually grew up with my husband, Steve, and he married my friend, Sally. And so those are some wonderful things about Larry. Larry is one of those people that I call on when I have an issue because he's usually got a solution or he knows where to find a solution. So one of the things that he's going to talk about today, I do have a happy dollar, by the way, is I finally got my in-laws an appointment for their vaccine. They've had their first vaccines now, and they have appointments for their second vaccine. And that was an issue. That was pretty tough to do, but we did get it done. And so I'm happy about that. And so Larry's here. He's going to talk a little bit about how come it was so difficult. So give Larry a round of applause and welcome him with a big Lions welcome.
All right.
Hey, good deal getting the appointment made.
Yeah.
Yeah, because that's no minor detail right now. Believe me, we know. There's a lot going on in the world right now with regard to COVID. I thought that if it's all right with you folks, I want to just share a few slides, just a refresher kind of thing, kind of bring you up to some speed on some COVID issues. And then if it's all right, we'll go ahead and I'll take some questions. I'll lie to you if I can't answer you, but no, I truly, I like to hear from different groups such as this because it either confirms what we already know or gives us more information to be able to seek out some answers. So if it's all right, I'm going to go ahead and share this little screen here. Maybe. There's, boom. Can you see my screen now?
Oh, now.
It says 2019 novel coronavirus, correct?
Right.
Okay. So I just wanted to bring this up because even as this has gone on, it has changed. Originally, it was known as 2019 novel coronavirus, and it was 2019-nCoV, and then they settled on COVID-19 for short. For those of you that don't know, the CO stands for corona, the V stands for virus, and the D for the disease. 19 is for the year that the outbreak began. There's been a lot of this going on. Monday morning quarterbacking. We go back through history, especially those of us that are really into sports. You go back 96 Masters and Greg Norman, where he had a 6-shot lead on the final day. And all of a sudden, 9th hole, shot rolls short, and then it goes back 30 yards. And then he starts a series of bogeys and ends up losing by 5 strokes. The 92 Houston Oilers, who led the Buffalo Bills 35-3 in the third quarter, ended up losing 41-38. The Mariners, our Mariners, I remember watching this game and I just felt it was coming. We were ahead 14-2, but they just started hitting and just little dinks and dunks, and next thing we knew, we'd lost 15-14. Same thing with the Yankees and the Red Sox in their playoff game. Yankees were up 3-0, leading in the 4th game, and all of a sudden, it now says Pat's entering the waiting room. Do I need to admit him? There, I did. I don't know if he got in or not, but I did it. And then they go on to, the Red Sox go on not only win the series, but then the World Series. And in 1967, I'm dating myself, I remember this race, the Indianapolis 500. Parnelli Jones was all the talk because of his new type of turbocharged race car. And he dominated this race until 3 laps to go. And you remember, it was because of a $6 transmission bearing that had failed. Yeah. So, but all of those things remind us of what we do after it happened. Well, he should have, he could have, they should have. We Monday morning quarterback a lot of things in our lives. And there's a lot of that going on right now with the COVID-19. Everybody's an expert now that we're in Tuesday about what happened Monday. So, I say that just to give you some context. Remember, it was first identified in December of 2019 in Wuhan, China. The WHO, the World Health Organization, declared it an outbreak in January of 2020, and then later in March, a pandemic. And then just a little information, as of the 2nd of March, more than 114 million cases have been confirmed worldwide, and more than 2.5 million deaths, making it one of the deadliest pandemics in history, even with all of our modern technologies and things. There's a lot of debate about the numbers. A lot of folks, and rightfully so, because nobody really knew what the right thing to do, what they were looking for. Early on in this, I remember the state of New York, like in May, I believe it was, of last year, everything was a COVID case. Everything in the state of New York that if anybody died, it was COVID related, because there wasn't clear guidance as to how or what you should be doing. So, this has evolved over the course of a year. Back in January 21, Governor Inslee signed a state of emergency for the state of Washington. In March, the Cowlitz County Board of Commissioners and all of the cities in the county signed over a document giving control to an incident command team to help manage this throughout Cowlitz County. And I just want to say that Cowlitz County has had a lot of really key successes in all of this. I know there's been a lot of failures. Those are easy to point out. But I want to tell you about 4 that just stood out to me. The first one was, we had in our county a model incident command team led by Dave Lefebvre and Robert Huda. And that right there alone is a stunning and staggering bit of information, because you had fire and police that were working together to be in charge of a major incident. Not a common thing across the country. And they did an amazing job of leading our team in Cowlitz County, which at one time had about 64 members on a type 3, and I can touch a little more on that if you want to get into the technicalities, incident management team. That team here in Cowlitz County was not only a model within the state of Washington, but nationally. And I definitely would not hesitate to put it up against any incident management team throughout the country. It was just tremendous about the ability that we had, the cooperation and collaboration between public, private, government partners working together to help each other out. School districts donating their supplies because they were shut down to help keep essential businesses running. It was just such a unusual time for all of us. We had this testing pod, which we allowed people to come and get their COVID testing during the months of December and January over at the fairgrounds, which doesn't seem so significant now, but at the time this was stood up, there were people screaming to find locations to get tested for COVID. And then now we have started last week with our vaccination pod, which is a point of distribution or dispensing. And the vaccination pod that was started last week is in support of local care providers and long-term care facilities. And just a little humor here. New and you gotta be kidding me buzzwords and phrases we now hear that, or have heard that maybe we thought we'd never hear. NPI, non-pharmaceutical interventions, social distancing. All stores are out of toilet paper. Who would have thought that a pandemic would relate to that was our biggest concern? The pandemic, self-isolation, quarantine. I mean, all of these are just different things that are now common to us that a little over a year ago we had not heard or had not heard in our regular vocabulary these words. So here's some things that I've learned over the last year. We did forget 9/11. I remember we said we'll never forget. And I know every year at the fire department when I go to the Cowlitz 2 event, I remember, not only that day, but I remember throughout the year the sacrifices that were made, and the fact that we said we would never forget. And I'm sad to say, as a country as a whole, I believe we did forget. Another thing I've learned is that there's no single point of contact for the vaccine distribution. And that starts at the federal level, goes through the state level, comes to the local level. And it's a problem. And we'll talk about this more with what Gina had said before we started. Leadership during a disaster should be based on knowledge, skills, and abilities, not political party, friendship, or desire. We have accomplished a lot of great things. Even though it's been very painful in a lot of ways, we've still accomplished a lot of great things. And my view, count on this being around at least 2 more years, and that's being optimistic. The new norm is going to be a combination of the past and what we are currently facing. So, and we're back, right?
Right.
So with that, I know Gina had asked me to talk about some things related to COVID. My role here at Emergency Management, what we do at Emergency Management, I'm sorry, I didn't introduce myself properly. I do work for Cowlitz County Department of Emergency Management. I am a coordinator here at the department, and currently am assigned to the COVID testing sites, the point of distributions or pods, where I help with traffic and flow. But one of the things that I know has been a concern, and we have tried to address it, but it's not our role. We, again, are a support agency. We support fire departments, police departments, health departments. We support people, sheriff's office, things of that nature. We work under the Cowlitz County Sheriff's Office, but our role is support. We don't take the lead on things. That's not what we're here for. And we are, if asked, we certainly can. We have the experience to be able to do that, but it's not our thing. And so it's really easy to throw arrows when you have the information. But think back to when this first started, and nobody really knew what this was all about. Nobody knew what it really was. And even to this day, to some degree, we really still don't know exactly what we're dealing with. And you've got those folks that believe in the vaccination, and we have folks that don't believe in the vaccination. And you have people that believe this is a government conspiracy, and those that say it's not a government. People are all over the board. I'm a firm believer that the more avenues we have to communicate, the less we communicate. But the thing is, one of the great things that has come out of this is look at how we're meeting today. Prior to COVID, would you have been willing to do something like you're doing here today and meet virtually? And the same thing goes for our schools and our education, our world of education. A lot of those teachers were forced into working via computer. Not an easy task if it's not something you're comfortable with. And I don't know about you, but whether it's GoToMeeting or Zoom or Microsoft Teams, or they all have their little nuances that if you're not on these things all the time, it is easy to get confused in what you're doing. And so I the sympathy that I have and the empathy from my fire service days of being first in on a disaster or an emergency, and all of a sudden everybody, the world's looking at you to say, what are you going to do with this? There's a lot of pressure on people. And if they're not used to dealing with that pressure, sometimes the decisions that you make are not in the right frame, I guess I would say. And when you're used to dealing with a world of politics versus the world of actual life and death. Sometimes your decisions can be swayed in the wrong direction. There's just a lot that's going on right now that if you would have offered me $1 million a year ago to be the president or the governor or any leader at that time, I would have said no thank you, because the decisions they had to make were very difficult. No matter what they did, they were going to be criticized. Right, left, didn't matter. The people were going to be criticized. And I'm not saying there weren't mistakes made. I'm not saying that there weren't really good things that were done. But what I'm saying is it was all trial and error. And so it's brought us to today. And some of the key things that I see are issues are getting people signed up to get vaccinated. And a lot of that goes, if you step back one step further, the reason we can't just get everybody vaccinated is because there's not a supply stream. There is a supply stream, but the problem is there's not a single point of contact. And because of that, for example, the federal government will direct ship from the federal government to a long-term care facility. Nobody knows about that except the federal government that sent this and the long-term care facility that received it. Nobody else is aware of this. Or you have a pharmacy that is sending something, a pharmaceutical company manufacturing, and they're sending this directly to a Walgreens or a Safeway or something of that nature. Nobody else is aware of this other than those two people. You have supplies coming from the federal government to the state of Washington, who then distributes it throughout the state of Washington. What's the matrix they use? How do they make their decisions? Nobody seems to be able to tell us. And then there are those individuals that are getting the companies that are getting the vaccine. And again, nobody else is aware of it until we hear about it or see it on social media, on a website, or in a newspaper article. So it's very, very difficult to know who's getting it, when they're getting it, and then once they've got it, they don't want to share with anybody else. And so that's a lot of the problem right now is the fact that universally across the country, there needs to be a single, there should be, first of all, rules. If you're going to receive the vaccine, you will do this with it. And that's not really clear. There are success stories like a retired National Guard colonel, I believe, that in West Virginia, that through his leadership, they vaccinated half the state of West Virginia. Related to how that correlates around the world, if they were a country, they would be the third most successful country in the world. And so there are successes out there, but there are a lot of challenges, and signing up for the vaccine is a great challenge that we've identified, but we have no control over. So with that, I will take questions. Yes, sir, Hal?
Hal, unmute yourself.
You're still muted, Hal.
Unmute, Hal. There we are.
Yeah.
I'm going to learn this one of these days. So, Larry, can you speak to how far and wide that PPE equipment went?
Oh, man. Yeah.
How much it helped?
This is one of the huge successes was this group and what you were able to do for our emergency responders throughout Cowlitz County. This was really big because if you remember, we couldn't get N95 masks to save us. They were as scarce as toilet paper. And, you know, it was just very, very difficult for any of us to receive N95 masks. Now it's a whole different story. But back when we got these, it allowed our emergency responders from fire, ambulance, law enforcement to be able to continue to respond and safely respond for themselves, for their families, and for their coworkers in order to stay afloat. So, yeah, this was huge in Cowlitz County, and another one of the great successes that. Thanks, Hal, because I did. That was my byline that I put on my note pages, but I don't have my note pages. Is that you folks were really, really key in getting us those APRs. So I want to say thank you. I never had to utilize that, but I know the people that come to my house, if I need them, they did, and so. Yeah, that's definitely a tip of the hat to you folks, because another example of how Cowlitz County, another one of our great success stories. Thanks, Hal.
Thank you. Larry, do you have any more statistics at all on after effects if someone had the COVID besides the smell? Because I am hearing two other things. Short-term memory is not good, and being emotional is another one. And yes, I had COVID pneumonia. So I'm just wondering, is there anything more? Because I have talked to quite a few people out throughout the country about this.
Yeah, and what you probably have found, Dolly, is that it depends on who you talk to. Because, for example, I have had both of my shots now. I received my second dose on last Thursday, and both within my office, there's three of us, and my boss, he received his. He was the first. He is a sheriff's reserve in Wahkiakum County, and he received first dose and second dose. No issues. My coworker, same thing. First dose, second dose, no issues. A couple of our volunteers received their first dose and second dose, no issues. Me, first dose, I was sick. I was in bed 24 hours. It started 30 hours after the first shot, and I was, the chills, the bones hurting, the whole 9 yards, and I was down for 24 hours with that. Received the second dose, and I was fortunate. It was a whole 6 hours afterwards that I started getting, what I had was pain in my feet, like similar to gout, muscle cramps through my legs all night, keeping me awake all night long. Then in the morning, 12 hours later, that's when I started the fever and the chills and the joints hurting. Another 24 hours. And everybody you talk to seems to react differently, whether it be to the vaccine or to actually having COVID. And I've heard a lot, getting back to your question, Dolly, I have a state conference call that I participate in, usually weekly, and it seems that every week there are new things that have come up that people find long-term effects, some new short-term effects, but they directly relate it to the COVID. So to have a specific list for you, no, I couldn't. It's just really bizarre how broad this is. I guess I could ask how during the Spanish flu, how did it affect people? No, I'm sorry. I just had to throw that out there. Sorry.
That's all right. You made everybody else happy.
So anyway, Dolly, I really don't. It seems like it's all over the board.
Oh, so on the same thing, if people have had it, is it better to wait to get your immunizations because you still have antibodies in you, or do you know anything about this?
Actually, I don't have the exact answer on that. Cowlitz County Health and Human Services website probably does. I know that for testing, during the testing process, people were told once you have it, then once you test positive, you had to wait 3 months before you could test again. And that's because it will show up in your system and 3 months, remember, is kind of an average. For most people, it might be a little less, but for others, it might be a little longer. And the 3 months was the average. And that's also where the quarantine timeframes came from, was based on the fact that some people would test and they would find that they had significant ability to spread for up to 3 weeks at a time. Some, it was a week. And so they just kind of split the difference and said, 10 days to 14 days. And we should be, our chances are much better if people are able to do that.
Okay. Thank you.
Uh-huh. Sorry to be vague.
No, that's okay.
Yeah.
I have something interesting. Talk about how it affects people different. Steve was sick a couple weeks ago, and his work told him that he had to have a doctor's note or a positive or a negative COVID test to come back to work. So he called his doctor, and they had a phone conference. The doctor told him that, wrote him a note and said that he didn't have any symptoms of COVID, that he should be allowed to come back to work. And I went in and got the note from Kaiser, and they brought it home for him to attend work. And then later, the doctor called and told him he needed to come in for a COVID test because there are people reporting only having nausea and being positive with COVID. So those of you who haven't had your COVID vaccinations yet, there are the symptoms are changing, and he didn't have a headache. He just was nauseous, and so be careful of that. So that's something that is happening in Cowlitz County. Obviously, he did get his COVID test and tested negative, so that's all okay. But the doctor was aware of it and called him back to have him come in and get one.
Okay.
Yeah, and if you remember back early on in this, when we didn't have the ability to test or didn't have enough ability to test, I know a lot of people were complaining because they would call their doctor's office and explain to their doctor what they had, and the doctor would say, sounds like you got COVID. Well, they didn't have any way to test, and so the idea was if you had those symptoms and if you quarantined for 14 days, again, that was within the 2-week guideline that they were, taking the average of, and figuring that if you had it, you would only be contagious for those 2 weeks. So, again, part of our learning process.
Dwayne?
I might mention that if you donate blood with either of the services, they do an antibody test on the blood and will let you know if you've been positive. And also, something I just learned the other day, the Red Cross says that you can go ahead and donate blood if you've had the shot for COVID, which was kind of news to me. I donate blood every couple of months, and so I've been tested a couple of times, and I had my shot last week, and I will be getting another shot the middle of this month, and I will be donating again at the end of this month. So even if you get the shots, you can still donate, and I assume that it's going to show that I have antibodies. At least it should, since I get the shot.
Right.
And not to be Debbie Downer here, but just something to keep in mind. We think the vaccination is going to be just a one-time thing where you've got to either get the single Johnson & Johnson or the 2 Pfizer or Moderna shots. But remember, we really don't know.
Yeah.
And that's why I say I plan on this being at least a 2-year process going from now, because we're going to learn. We're going to learn if it's true or not, if it's true in everybody or just a percentage of the people that are getting it. It's not a certainty that this is all going to be good.
Larry, how long do you think it's going to take to get everybody up to the states up to 70% vaccinated?
Well, just a straw poll that, was conducted by a couple of organizations, that I'm aware of throughout Cowlitz County, trying to find out how many of their personnel were interested in being vaccinated. The highest percentage that I saw of an agency was 60% of their people planned on seeking the vaccination. 30 to 50 was more common. There's a lot of folks that are wait and see what is in this vaccination, what's it going to do to people. So with that, looking into next year at least to get up to 70%.
Okay. You think the Johnson & Johnson, since it's a one-time shot, will be more people because they're afraid of shots?
I saw a good program yesterday actually on TV that was talking about this, and they said that, when a shot is offered, take it, regardless of if it's, now if you start with one, that's the one you should stick with. So like if you get Moderna, your second shot should be Moderna. If you get Pfizer, second shot should be Pfizer. Johnson & Johnson, 1 shot. It's a great thing, but they're saying don't hold out for the 1 shot unless you absolutely have to. I believe that'll be huge. That's going to make a huge difference, because that single shot is, like you say, people there are people that are deathly afraid of getting a shot. Right. And that's, I get it.
Al?
Well, cases are down also, and it seemed to happen quite quickly after the immunization started. Some people, that doesn't make a lot of sense, but because it's such a low percentage nationwide now. What are your thoughts?
Well, the combination of things. We've finally got through all the major holidays. The only major holiday we've had basically since New Year's was Super Bowl parties.
Right.
And so, we still might see an uptick. We're pretty much through that, but we might still see an uptick from that. We did see 5 deaths over the yesterday, reported this morning. So that was a bit of a shock. But generally speaking, I think we're just in that time. And the other thing is, this is Larry on epidemiology, so take that for what it's worth. I can't spell it, but I can say it. I stayed at a Holiday Inn once. But the fact of the matter is that people are saying, well, sure, we're not having any flu this year, but we're sure having a lot of COVID. But if you think about it, for those of us that are following the NPIs, the non-pharmaceutical interventions, and we're social distancing, we're wearing a mask, we're washing our hands more. Isn't that what we've said over the years would help prevent or slow the spread of flu? And maybe the fact that more of us are doing that now is making a difference. I don't know. But I think, Hal, I think that it might be coincidental, but I think it has to do with the fact that we're through most of the major gathering season right now.
Mm-hmm.
And getting vaccinated right now, that will help, because going forward, even though it's probably a very small percentage overall, it helps. And every little bit is going to help, whether it be isolating or watching the social gatherings or getting a vaccination.
Okay, Kurt?
Yes, I had a question just kind of basically along those lines of how we're doing, because you've said we've had some successes and we've had some failures. The state of Washington, we've had 5,000 deaths, which, you know, that's a tragedy, but we went from number 1 in the country to number 29 now. A bunch of states have passed us that have less population and have lost more of their citizens. And I think Cowlitz County, we've had 63 deaths or so. And my question to you is, how has Cowlitz County, because I couldn't find any statistic comparing to other counties, how have we done? Is that good? Is that, I mean, kind of just overall, how have we done?
We, as far as deaths, or are you talking about rate of infection?
Just the rate, just our response in general. I'm just looking at the numbers, the raw numbers. The state of Washington has overall done, you know, kind of the best in the country. If you look at our curve and that kind of stuff, I was just wondering how Cowlitz County has done.
We have done very well on the important number, which is deaths. We've done very, very well. Any death to me related to something that is preventable is tragic, but I know that we've lost a lot of loved ones over the last year. But compared to other states, compared to other counties within our state, we're not like up near the top, but we're definitely not near the bottom. When we regionalized the health system for the vaccination distribution, that put us in with Clark County, Skamania County, Wahkiakum County opted out. But that was on some instances a good thing, and in some other instances not such a good thing. Exactly for why you were saying, Kurt. The folks here locally seem to have done a pretty good job until they had enough. That initial 3 months where we pretty much shut down and isolated was a really good thing, because Cowlitz County really took that to heart, and they did it. And unfortunately, there were others that did not. And we ended up with some significant spread that just by the fact we're on the I-5 corridor, and we have a lot of businesses that deal with, you know, places from throughout the state, throughout the country. It was just, it's hard to just, you know, unless you're Belgium and you just completely shut down your borders and nothing comes in or goes out. But overall, Cowlitz County, we're probably in the middle of the pack, I would say, Kurt. That's my guess.
Well, thank you, Larry, for your information today. It's a very informative that you gave us today, and we appreciate you taking your time to give us what information you could. And I would say thank you very much as a Pioneer Lion.
Thank you all. I appreciate your time.
Thank you.
And I don't want to be rude, but I've got another meeting, so I'm going to hop off.
Okay.
Thank you. Thank you very much.
Thank you.
Thank you, Larry.
Bye now.
Okay, a little review. Sign up for a week from Friday with Lloyd on 2-hour shifts starting at 10. And next week is orientation. Steve will do orientation. So if you have a new member and you are their sponsor, try to be on board for their orientation. Is there any other information that I missed? Okay. Doug?
Just a couple of reminders on membership. You have a membership drive going on right now where Dolly and I are offering a week stay in Maui. To get involved is to bring in a lion, bring in more, you get more entries into the drawing, which will occur in July. So you got up to June 30th to do that. The other thing is Dolly came up with a great idea. She said, bring in your spouse or your significant other. There are a lot of lions in our clubs that have wives or husbands or significant others that are not lions. Easy to do it. There's no induction fee, and the monthly through LCI is a lot less. So
That could get mucky.
keep that in mind because we are trying to get back up to strength.
All right.
I'm sorry?
So,
Cindy,
did you have a comment?
No, I'll pass.
Zoning.
Oh, zone meeting tonight.
Zone,
That's good.
well, it's not a zone workshop tonight at 7.
Workshop tonight at 7 o'clock. We're going to talk about the graduation program and Nights of the Blind.
Okay. All right.
Zone conference is the 8th of April.
Okay. And we have, I know we have Nights of the Blind later this month also. So, any other information? If not, I will adjourn this meeting and we'll see everybody next week.